Go.
All right, hello everybody. Welcome to the next EMT renewal module. This one's going to be on trauma patient assessment. Before we get started on the trauma patient assessment, when you have a trauma call like any other call, you always want to start off with your basic principles of all patient care, which should start with your scene size up. Your scene size up starts when you get the call. Everybody in their jurisdictions know what type of calls happen and what different intersections and what different neighborhoods, stuff like that. When you are arriving on scene, remember to start with your scene safety. We could spend hours upon hours on scene safety. We're going to have to leave it up to the company officers to determine what scenes are unsafe, what are safe, and what are ways you can make your scene safe. The next thing you want to do is get your BSI assembled, and each call is going to be different, but your minimum for your trauma patients is probably going to be gloves and some type of eyewear. If it's a trauma call that has a lot of blood, you might want to consider a mask as well as a gown. The next thing you want to do is you want to try to determine the number of patients you got. Far too often we get on a call where it's a vehicle accident or something like that, and people are trying to pull us in the direction of the patient who's bleeding the most, and they think that patient's the worst, and we end up getting stuck on that patient when there's other people that need to be seen. So try to get a good number of patients and try not to stop at each patient for too long. Determine your number of resources that you're going to need. Do you need to call another fire truck? Do you need another ambulance? Don't be afraid to call for more resources. Then you want to determine your mechanism of injury. What caused the injury to the patient? Was it a vehicle versus a pedestrian? Was it a gunshot, stabbing, stuff like that? You definitely want to determine your mechanism of injury. If it's a vehicle accident, you look at the inside of the car. It's going to give you a lot of indications on where your injuries are going to be. Once you've done your scene size up, you want to start with initial assessment. Of course, initial assessment is done on all patients, whether it's a trauma patient or a medical patient. The initial assessment is going to start with checking to make sure your patient's alert. If your patient is unresponsive, or if your patient's only responding to verbal stimuli, you want to go ahead and perform an airway maneuver at this point. And because it's a trauma patient, it's probably going to be the job for us. Once you've determined your level of responsiveness, you want to determine your patient's breathing. Okay? Is the patient breathing? Just do a quick rate and quality. We're not asking you to take the full vital sign. Just 15-20 seconds, see how good your patient is or is not breathing. Once you've determined the patient's breathing capabilities, you want to check your patient's pulses. Now, because it's a trauma patient, we want to check both of our carotid pulses, located on the neck, as well as our radial pulses on the wrist. And the reason we do this is because a lot of times, some of the early signs of symptomology of shock, you're going to lose your radial pulse. So that's why we're checking both of them at the same time. Once you got through your initial assessment, now it's time to start your trauma assessment of the patient. Your trauma patient assessment should start with somebody taking C-spine. Alright? And in order to hold C-spine correctly, all we're going to do is we're going to take the patient, we're going to take the head where we find it. You are allowed to move the patient's head into a neutral position because this is going to make it easier for the airway to stay open. So my partner here is going to go ahead and take C-spine. Now we're ready to start with our rapid trauma assessment of the patient. Now when we're doing this assessment, this hands-on approach to the patient, we're looking for what is known as DCAP-BTLS. And DCAP-BTLS stands for D is deformities, C is contusions, A is abrasions, P is for punctures or penetrations, B is for bruising, T is for tenderness, L is for lacerations, and the final S is for swelling. So we're going to use this DCAP-BTLS as we're going from the patient's head to the patient's toes, but we're also going to be looking for a couple other little things. Now before I start with the rapid trauma assessment, let's talk a little bit about some controversies that we see with our trauma patients. The first controversy is whether a patient's wearing a helmet. And should we take this helmet off or should we leave this helmet on, whether it be a football helmet or a motorcycle helmet or something like that. The reason we would take the patient's helmet off prior to EMS's arrival or prior to transport is if your patient's unresponsive, you're going to need to get that helmet off the patient so that you can go ahead and establish an airway maneuver. Remember, I was telling you, if a patient's unresponsive, one of the first things we need to do with any trauma patient is get that airway open. Another reason why you might want to take the helmet off is if there's significant damage to the helmet. If there's significant damage to the helmet, we want to get underneath that helmet and get a good visual of the cranium to see if some of that damage is transmitted into the inside of that helmet. If any blood is present from underneath the helmet, another reason we would want to get that helmet off, we want to see where's that blood coming from, how bad is the bleeding, and we're going to need to control the bleeding. And then finally, if the patient's helmet does not fit snugly, you're definitely going to want to take that helmet off. And here's why. We're going to put them on the backboard, we're going to secure that helmet onto the backboard, but if the head is not secured in the helmet, then the head's going to continue to move throughout transport, and it's going to aggravate any cervical injuries that the patient may have. The next controversial subject of trauma patient assessment is if we're going to be removing the clothing. Now, everybody has their own opinions on clothing removal, but here's my thoughts on clothing removal. It's okay to take the clothing off of a patient if you think the patient has an injury that you're going to need to assess visually. All right? But if you are removing the clothing from a patient, if it's possible, let's go ahead and leave on the underwear, and if it's a female, the bra. All right? Unless there's a soft tissue injury that you really need to look at, there's no reason in the world why we need to be taking off any of the undergarments from a patient. And remember, if you are taking off clothing from a patient, if it's a stabbing or a shooting or some type of call that relates to a crime, we want to be careful where we're cutting to preserve that evidence for law enforcement. Another controversial subject on trauma patient assessment is if you find your patient in the prone position or laying on their face. When do we need to roll them over? Well, here's the thing. If you have a patient that's been suffering a traumatic injury and they are laying on their face, you want to roll them over as soon as you possibly can. And here's why. All patients suffering from traumatic injuries need oxygen. We can't do the oxygen if they're laying in the prone position. If you have the resources and a good log roll technique to get the patient from their stomach or that prone position into the supine or on their back, it takes 3 people. 1 to hold C-spine and 2 to accomplish the roll. So you're going to have to play this one off by ear, but as soon as you can get them rolled over, the better off it's going to be for the patient.
Medic 7 respond. Altered level of consciousness.
All right,